This video we're going to look at the WHO, that is the World Health Organization, and looking at the classification. So classification of the nutritional status of the infants. So to start off with questions, the first question is what is the underweight category? The second one is what is considered severely underweight? The third question is what is the severe acute malnutrition? So these are to be answered in case of BMI and the standard deviation. So you'll find out the answers to all these questions, and in the end of the video there is some bonus questions. So to start off with, we are looking at the class of obese. So what is obese? Obese means that the weight for height. So the weight for height by length is greater than 3 standard deviation. Other thing to note is that the BMI for the age is greater than the 3 standard division. So greater than 3 standard division is nothing but obesity. Now moving on to the overweight category. So what is the overweight? So a person is known as overweight, that is birth to 5 years, in case the weight for height is to length. So this is greater than 2 st, that is standard deviation, and less than 3 standard deviation. So then we look at the BMI for age. So the BMI for age, so this will be greater than 2 standard deviation and less than equal to 3 standard deviation. Then we move on to the moderate, the moderate underweight. So what is the moderate underweight? The moderate underweight, it refers to the weight for age. It refers to the weight for age is less than -2 standard deviation and greater than equal to -3 standard deviation. So this is moderately underweight. Then we look at the class of severely underweight. So what is severely underweight? In case of severely underweight, the weight for age, if you look at, there is weight for age. So the weight for age, this will be less than the -3 standard deviation. This is severely underweight. Then we move on to the moderate acute malnutrition. So in terms of moderate acute malnutrition, the weight for the height is divided by the length. Weight for the height divided by the length is less than equal to -2 standard deviation, and as well as greater than equal to -3 standard deviation. Then we look at the BMI for age. So if you look at the BMI for age, it is less than equal to -2 standard deviation and greater than equal to -3 standard deviation. Then we look at the mid upper arm circumference. So if you look at the mid upper arm circumference, so in this case, in moderate acute malnutrition, the mid upper arm circumference is greater than 115 mm and less than 125 mm. Then we move on to the SAM, that is a severe acute malnutrition. So in terms of SAM, that is severe acute malnutrition, the weight for the height is to the length. So this will be less than the -3 standard deviation. And what about the BMI for age? So the BMI for the age, this will be less than -3 standard deviation. Then we look at the mid upper arm circumference. So the mid upper arm circumference. So this is nothing but it is less than 115 mm. Next, what we have to see is in case of the severe acute malnutrition, there is also presence of the bilateral pitting edema which is found. Then we move on to the category of moderately, there is moderately stunted. Moderately stunted, or it is the moderate chronic malnutrition. Moderate chronic malnutrition. So in this case, the height, comparing the height to the length for age, height to the length for age, this is nothing but it is less. It is less than the -2 standard deviation, and it will be greater than equal to -3 standard deviation. Next, we move on to the severely. We move on to the severely stunted or severe chronic malnutrition. Severe chronic malnutrition. So in this case, what we see is the height to the length for age. So we are looking at the severely stunted or severely chronic malnutrition. So the height to the length of our age, it will be less than -3 standard deviation. Next, what we see is moderately wasted. Moderately wasted. So what is moderately wasted? Here the weight for height per length, this will be less than -2 standard deviation and greater than equal to -3 standard deviation. Lastly, we are looking at the severely wasted. So what is severely wasted? So in terms of severely wasted, it includes that weight, the weight for height by length. So the weight for height by length. So this is nothing but it is less than -3 standard deviation. So now moving on to answer our questions. The first question we asked was what is, just answering our questions. So the first question we asked was what is considered as overweight. So overweight is nothing but the weight for height divided by length is greater than 2 standard deviation and less than 3 standard deviation. This is considered as overweight. So looking at the BMI, the BMI for age. The BMI for age is greater than 2 standard deviation and less than equal to 3 standard deviation. The next question we asked was what is severely underweight. So in terms of a severely underweight. So what is severely underweight? So severely underweight means that the weight for age, the weight for the age is less than -3 standard deviation. Next, we move on to the third question. The third question we asked was, what is the severe acute malnutrition? In short, it is known as SAM. So here, the weight for height, the weight for the height divided by the length. So this is less than -3 standard deviation. Then if you look at the BMI for age, the BMI for age, BMI for age is less than -3 standard deviation. Now we move on to the mid upper arm circumference. So in case of SAM, the mid upper arm circumference, that is in short it is known as the MAC. So here it is less than 115 mm. And there is also characteristic bilateral pitting edema. So these were the questions we asked. Now moving on to the bonus questions. So these questions can be answered in the comments. So the first question being, what is considered as obese? Second question is what is considered as moderately underweight? Third question is what is considered as moderate acute malnutrition? So these can be answered in the comments.